Hi, I'm Steve Carstensen, and I want to talk to you a little bit about children's airways. We think about kids and sleeping and breathing differently than we think about adults. We think about growth and development in children. So if we look at some of the consequences, starting at the upper left of this little chart, and if we have a child who doesn't breastfeed properly, doesn't develop good habits early on, or uses the wrong kind of pacifier, for example, we can end up with underdeveloped dental arches. There's just not enough bone space there. And when there's not enough space for all the soft tissue parts, then we end up with a child who won't breathe through their nose and they breathe through their mouth all the time. There's lots of troubles with that, including too many allergens passing into the airway. That can cause overgrowth of the tonsils and adenoids as the body tries to fight off those allergens. It can cause a poor development of the upper maxilla, and so then poor development of the mandible as well. So we have less bone space to put the teeth into. And so we end up with not only sleep disorder breathing, but we have bad alignment of the skeletal base of the jaws and a bad alignment of the teeth. We try and make up for that with orthodontics later on, but we never get the body back on track and end up with a nice open airway that they can breathe through. So we have chronic lifetime problems that turn into adult problems, but before they even get to adults, they have problems with ADHD, they can have allergies, nightmares, not performing well in school, not being a good part of their social group, all stemming from underdevelopment of the dental arches and jaws when they're tiny babies. We can affect that with the care we can provide even these kids at young ages through our dental offices. You have to learn a lot more about that. And there's many places you can go from that. But one place you can go to get kind of started on that is adaceonline.org. And you can download this little chart. It doesn't give you much information, but it might stimulate a new way of thinking about these small children in your practices. adaceonline.org. Go there and start to learn about sleep disorder breathing and even the smallest patients in your practices.